So today we're gonna start a very important topic, which is actually cleft lip and cleft palate. What happens in the cleft lip? Basically, it is an abnormal development of the median, nasal, and maxillary processes. When these processes do not properly develop or do not formed, due to which the cleft lip developed. And cleft palate is basically the failure of the fusion of palatine processes. So first it is the median, nasal, and maxillary processes that fails, and then it is palatine processes that fails to fuse, so it forms a cleft palate. So the types of cleft lip: one is central, the other is lateral. One is complete, another is incomplete. Central is very uncommon, and it is due to the failure of fusion of two median nasal processes. And lateral is one of the most common, when there is a cleft between the frenum, when there is a cleft between the frenum and the lateral part of the upper lip. It is due to the imperfect fusion of maxillary process with median nasal processes. Okay, and this can be lateral, can be unilateral and bilateral also. Complete and incomplete. In case of complete, a variety of the cleft lip extends to the floor of the nose. In case of incomplete variety, the cleft does not extend up to the nostrils. Then you have simple and compound. The compound refers to the cleft lip that is associated with the cleft in the alveolus. Okay, so you can see here that basically normally what is this is actually your lip, then this is your hard palate, then your soft, and then uvula. Normally it is like this. When you come across to this is actually unilateral cleft palate. It crosses your lips also. Okay, so you can see here this is actually a unilateral cleft palate, and this is actually bilateral cleft palate. Okay, now coming towards, now this is unilateral cleft lip. It involves your hard palate also. This is unilateral cleft lip that has involved your soft, hard, and uvula both. This is bilateral, of course, cleft lip, and this is also bilateral cleft lip that involves all the structures. In 80% cases, the cleft lip is actually unilateral, and 60% cases it is actually associated with the cleft palate, which I have which you have seen also, that the patient with the cleft lip also will have the cleft palate also. In many cases, the nostrils are widened. Okay, so basically this is the maldevelopment, or you can say malalignment of teeth also in relation to the cleft is common, means that the patient teeth are not properly aligned. What basically it affects when patient has this? It affects the sucking. It does not affect the sucking, but it can affect the bottle feeding and large difficulty in speech to the patient. Now basically the cleft palate, which is actually failure of the fusion of the palatine processes. It actually happens when the palate developed in the 6 or 8 weeks of intrauterine life, and it has three components. Either it is premaxilla, that is actually from the nasal median nasal process, or maxillary process also contribute to one of the palatine process. This line of fusion is basically formed Y-shaped, and imperfect fusion results in the cleft palate. Basically, they had two types, which is complete and incomplete. Incomplete, what happened when there is a failure of fusion of palatine process and also the premaxilla, so it forms a complete cleft palate, in which there is a connection between your nasal cavity and mouth that are connected. When maxilla is not fused with both the processes, so it hangs down from the septum of nose actually. Complete palate is the fusion of the three components that palate takes, but it starts from the uvula and then backwards, and then various types it has. It has bifid uvula, and the whole length of soft palate is bifid. Okay, then the soft palate and the posterior part of hard palate is also involved actually. On the other hand, interior part of palate is normally developed basically, but in about 25% cases cleft palate is alone. In 50 cases, cleft palate and cleft lip is actually connected. The patient with the cleft palate actually have difficulty in swallowing, cannot pronounce the consonant sounds, has basically overcrowded teeth. Actually, upper lateral incisor may be small, even the absent, and the maxilla is actually smaller. The patient has the respiratory tract problems, and the patient has also hearing problems, such as actually even chronic or otitis media.